Alright guys, this is the third in the set of what we call your postural stabilization exercises, the ones that you're supposed to be doing at home that help you hold your adjustments. And again, some of these are neck, some of these are mid-back, some of these are low back, but at the end of the day when you do these exercises, they're all stimulating the same part of your brain, and all your muscles along your spine, your true core muscles, all work together anyhow. So a lot of times I'll have patients do the entire set of exercises. Right now we're going to show you the low back stabilizer exercises, and many of you have done a version of this before. We assign different names to them. I just wanted you to get the technique down and to kind of watch what we're doing, because again, you've got your brochures that we give you. Sometimes it's a little confusing as to how you do them. So again, this is for review, and you can watch this as many times as you want on the website. The first one they're going to recommend is what we call the prone extensions. Prone meaning face down, extensions meaning you're just extending. And a lot of times people will equate these with what we call Superman exercises. And the problem is a lot of times you guys are hyperextending, or you bring your head too far off the table. So when you lie face down on the table and you're working your low back, you're still working your mid-back a little bit and your head. And we're bringing ourselves back and up. Remember, you've seen me say this before. We all live here, we all work here, we all kind of tend to play here. So our goal is to bring you back and up. Promotes the posture, helps hold the adjustment, gives you more energy, less pressure on your spine and muscles, the list goes on and on. So in the first one, we call it a prone extension or a Superman. And again, you're just lying face down on the floor, on the bed, wherever you want. It's not going to take long to do the exercises, so don't worry too much about the comfort level. What matters is that you engage both the neck, the mid-back, and the low-back muscles, and you come up off the table 2, maybe 3 inches. It's not a big deal. You don't have to come all the way back up and hyperextend that. We're then going to do something called a banana and something called a bridge. And I'm just showing you this on the spine right now because I'm going to demonstrate these. But when you do a banana and you're laying on your side facing me, it's just like you would think. You're going to create the shape of a banana. So your upper torso and your lower torso come off the table. Right? So the legs are coming up and the head's coming up. And you're just going to hold that for a second and you're going to go back down. All right? And then the last one we're going to talk about is something called a bridge. It's a lot like a plank, but a lot of times when you're planking, you're face down. When you do our bridge, you're actually going to be on your side, and you're going to raise yourself the opposite of the banana. It kind of seems crazy to show you the spine, so I want to demonstrate them right now. But they're wonderful exercises for helping you hold your adjustments, and they really stabilize preferentially the low back, then secondarily the mid back, and then a little bit of your neck. So I'm going to show you the prone extension first. All right? So you're going to lie face down, and not everybody has a chiropractic table or a massage table at home. But you're going to lie face down. I don't care if your hands are by your side or if your hands are up front. But the motion is very, very simple. Your head's going to come up first. You're going to tilt it a little bit. And then you're simply going to raise your upper torso off the table and back down. There's never a need for you to hyperextend or come too far off the table. It's not what we're trying to achieve. We just want to use those little muscles that sit around our spine. And again, it's not a fast pace. 1 1,000, 2 1,000. And you're doing about 3 sets of 10. So those are the prone extensions, or what we call the Supermans. You only want to be coming off the table a couple of inches. Now, when you go to do a banana, you're going to do this exercise on both sides. But when I utilize my right-sided oblique muscles in my abs and a little bit of the right-sided spinal muscles that I have, this is what it's going to look like. And you want to start as straight as you can, and you simply want to come up off the table. And you're not holding that posture. And at first you might have to stabilize yourself with your hand, because you're not going to have the ability to do these very well, especially if you're in pain. But you're just going to move yourself into the shape of a banana and drop back down. Now immediately you're going to go into what you call your planking position or your bridge. You're just going to create a bridge right here. And it's real important to use your hand or hands to stabilize yourself here. And you start in this position and you simply raise up. And you're just creating that gap. And if you really want to know what's happening here, you're just creating a bit of a space between your hip and the table or the ground or the bed. The bed's probably a little too soft to do this on. So from this position, I'm going to come up and come back down. Now I'm utilizing the muscles on the opposite side of my spine in a little bit different manner than just the banana. From here, we're going to flip straight over, and you're going to go right into your banana for this side, raise off the table, your head, your upper torso, and your legs, and then you're going to go right into the bridging. And again, we're always doing 3 sets of 10 with all these exercises. So just to recap, the Superman where you're lying face down is a prone extension, 3 sets of 10. Then you're going to lay on your side and do a banana. You're going to stay on that side and brace yourself to do a bridge. And then you're going to flip over and do the banana and the bridge again on the opposite side. So 3 sets of 10 of all those exercises isn't enough to fatigue you, but it's certainly enough, especially if you're doing it once a day, to help you stabilize your posture and to help you hold your adjustments. They're simple. I'm going to test you. Look forward to seeing you in the office. Bye-bye.